programa esteve no 25º Congresso de Medicina Física e Reabilitação. A presidente da Associação Brasileira de Medicina Física e Reabilitação é a doutora Regina Schweire, aqui de Rio Preto, e o congresso aconteceu aqui na nossa cidade. O programa entrevistou 2 médicos de fora do país que trouxeram novidades no tratamento com o Botox. Acompanhe!
Eu estou impressionada. Por quê? Porque aqui é uma cidade maravilhosa, uma das 10 melhores do Brasil, porém não é cidade turística. Então os congressos geralmente são em cidades turísticas. Então quando eu fui eleita presidente e resolvi trazer o congresso para cá, que eu acho que é um presente para Rio Preto, trazer as pessoas mais importantes do Brasil e outras do mundo, discutirem reabilitação, se a gente diz assim, você é louca, né? Porque não vai ter público. E nós estouramos, estamos com mais de 700 inscritos e 109 trabalhos científicos e pessoas de todos os estados.
E foram discutidos, é claro, diversos assuntos, são 109 estudos, abrangeu-se de tudo?
De tudo, porque a reabilitação nós trabalhamos desde atletas até pessoas com sequelas neurológicas, até agora está tendo uma mesa de reabilitação oncológica, reabilitação infantil, amputados, trauma, dor crônica, postura. Então, olha, foi maravilhoso com vários profissionais da área de saúde e um engajamento grande dos alunos de medicina, que isso é muito importante, porque eles precisam saber. Você sabia que na faculdade de medicina não se estuda reabilitação? Então a pessoa fica deficiente, vai procurar um médico, o médico não sabe como tratar.
E hoje essa moçada nova que vem vindo aí, esses estudantes devem amar muito, porque tem muita tecnologia envolvida, né?
Muita. Nós trouxemos tudo que tem. Isso, nós temos robôs, então teve todas as aulas de robô, aquelas próteses não convencionais, equipamentos para tirar dor. Todos os grandes fornecedores do Brasil estavam aqui, fornecedores alemães, olha, foi um sucesso.
Dr. Simon, you came all the way from France to talk about a new treatment. Talk to us about it.
Yeah, so it's a botulinum toxin, like Botox, called Xeomin. It's a new one, who allows to treat the patient with higher doses, meaning that before you can treat only the lower limb or the upper limb, and with this drug, at the same time, you can treat both the upper and the lower limb, which is much better for the patient.
Can we do it?
We can do it. It's safe, so that's what we had to demonstrate, that it was safe, and it's a safe product. It's not approved at the moment, so it was just a research. So to have it approved that the physician can use it will take a bit of time, but at least we have demonstrated that now we can treat the patient, and so it's better for them, because before you had to choose between treating upper limb or lower limb. So we hope that in the future we can be approved and better treat the patient, because these patients are disabled patients and they really need this kind of treatment.
Hey, doctor, who can benefit from this treatment? Because we talk to common people, so who can benefit from it?
It's all the patient who had, for example, a stroke or a traumatic brain injury, or it could be a brain tumor, or who had what we call paralysis, and then they can have symptoms that we call spasticity, and this is very disabling for the patient because it makes their move more difficult. So with this treatment you can improve this, and then they can better move, they can better walk, they can better use their hand, and they can as well, that has a big impact on their quality of life.
That's good. Thank you very much.
You're welcome, my pleasure.
Professor Dr. Anthony Ward, who can benefit from the treatment with Botox?
The main group of people are people who have had a stroke or a brain injury, people with chronic migraine, people with dystonias, which is a sort of movement disorder, particularly of the head and neck, and also children with cerebral palsy. People who have these conditions are affected by movement problems in the limbs, and Botox and botulinum toxin reduces these abnormal movements. to allow then physiotherapists to train the patient, to train the person to move more normally. And that is the whole essence of Botox or botulinum toxin therapy, that you inject it into a muscle and then the therapist works on other muscles to restore the normal balance that we all have in moving and in allowing people to use their hands, to walk and to function.
Probably it's very relative how far you can go with Botox because patients are different. But can you improve quality of life?
Very much so. We have done a study called the BEST study, in which we showed an improvement in function, improvement in walking, but also an improvement in quality of life. Because imagine if you have a stroke or if you have a severe illness and you are rendered paralyzed and that movement then starts to come back, your quality of life will improve, usually, unless there are other things that get in the way. But it is very important. It is important to understand that it is normal to be depressed after a stroke. So therefore, if you respond to the rehabilitation program, and Botox is part of that rehabilitation program in these patients, then your quality of life will improve as well.
Doctor, thank you very much.
Pleasure.